Hi everyone. Today's talk is going to be on lung abscess. This lecture is based on Sabiston textbook of surgery, 21st edition, and we will be learning about lung abscess by doing a couple of MCQs and going through certain concepts. We must understand that lung abscess in pre-antibiotic era was mostly a surgical disease. However, in the modern antibiotic era, uh, lung abscesses are mostly managed with antibiotics, with very few indications existing for surgical drainage or surgical lobectomy. In the first slide, we are looking at an MCQ. Let us try to solve the MCQ. Mark the false statement regarding lung abscess. Option A. Lung abscess is identified as necrosis of pulmonary parenchyma caused by microbial infection. Option B. Most lung abscesses are secondary to bronchiectasis. Option C. Most lung abscesses are caused by anaerobes. And option D. All of the above are true statements. So you can pause the video and try to answer the question, or you can listen to the explanation. So we have to mark the false statement. So let us understand that when we talk about lung abscess is basically defined as a necrosis of the lung parenchyma being caused by uh, microorganisms. So microorganism causing necrosis of lung parenchyma. Okay, this is called as lung abscess. We must understand that most of the lung abscesses are happening secondary to aspiration pneumonia. And the most common organisms which are causing this lung abscess are anaerobes, which are most common organisms. These anaerobes are actually coming from the gingival crevices. They are the small gaps in the lungs, in the gums, and these bacteria, these anaerobes, reside within these gaps. And when aspiration happens, when it goes and lodges inside the parenchyma like this, and it causes a necrosis in the parenchyma, and this necrosis is actually called as the lung abscess. Now let us try to solve the question. The first statement, lung abscess is defined as necrosis of pulmonary parenchyma caused by microbial infection. This is a correct statement, is a true statement, and therefore this cannot be the answer. If you look at the second statement, most lung abscesses are secondary to bronchiectasis. This is false, because most lung abscesses are actually secondary to aspiration pneumonia, as we have discussed. Okay, option C, most lung abscesses are caused by anaerobes. This is also a correct statement, and all are true are not correct. So this is a correct statement, this is a correct statement, and this statement is absolutely false. These are secondary to aspiration pneumonia. Now we have understood certain basic concepts about lung abscesses. We will move on to the next aspect, and we will solve the next MCQ. The next MCQ is, which of the following organisms usually do not cause lung abscess? Is usually not does not. It is usually do not cause lung abscess. Sorry for the grammatical error. Option A is Bacteroides fragilis. Option B is Prevotella. Option C is Peptostreptococcus, and option D is Legionella. Which of these usually do not cause lung abscesses? To answer this question, we need to have certain facts in our mind. The facts are: the most common organisms which causes lung abscess are, these are anaerobes, and these anaerobes can be Prevotella, Peptostreptococcus, bacteroids, Bartonella. These are the most common. The other organisms which are not so common can be Streptococcus, Staph aureus, this Streptococcus pyogenes, sorry. Then is Staph aureus, followed by Klebsiella, pneumonia, and in certain cases Legionella, then Nocardia, etc. So these are all the list of organisms causing um, lung abscesses. So let's look at the first option, bacteroids. We have said bacteroids causes lung abscess, correct. Prevotella, yes, Prevotella also causes lung abscess, that is correct. Peptostreptococcus, yes, Peptostreptococcus also causes lung abscess, correct. And Legionella also causes lung abscess, correct. But there is a catch. There's a line in the Sabiston textbook of surgery which clearly says bacteroids do cause lung abscesses, but Bacteroides fragilis usually doesn't cause lung abscess. So therefore this question was made just to test this particular fact, whether this line was read or not. And yes, Bacteroides fragilis does not cause, and so the correct answer is A. Bacteroides fragilis usually does not cause lung abscess. Moving on to the next question, we have to choose the incorrect statement regarding lung abscesses. Option A, most patients of lung abscess show an indolent course. Option B, fever is usually absent. Option C, anemia can be present. Option D, inferior segment of a lower lobe is involved. Option E, posterior segment of the upper lobes are involved. Okay, so to answer this question, we need to know certain lines or certain facts, and they are as follows. We need to know that most of the patients who are affected with lung abscess are not very toxic, which means they are not very sick patients. It's not like they are going to die or we have to intubate them and they're in ICU. It's not like that. Most of the time, these lung abscesses show an indolent course. Alright, most of the time lung abscesses show an indolent course. But there are certain characteristic features, and these characteristic features are: 1. Cough, 2. Sputum, 3. Fever. These three are characteristic features, and these three are usually present. They also have associated features of chronic diseases like weight loss, night sweats, and anemia. Now coming to the most confusing part, which are usually present as options in the MCQs. The most important part is that these patients get affected, both the upper lobe gets affected and the lower lobe gets affected. in any particular side of the lung. And for the lower lobe, it is the upper segment which gets affected, and for the upper lobe, it is the posterior segment which gets uh, affected. Therefore, with these facts in mind, we can answer this question. Let us look at it one by one. Option number A: most patients with lung abscess show an indolent course, which is absolutely correct. They're not very toxic patients. However, fever is usually present. So therefore, this is a wrong option. Fever is usually present. Okay. And the characteristic features are cough, sputum, and fever. Moving on to option number C, anemia can be present, which is absolutely correct. These patients present with features of chronic diseases like weight loss, night sweats, and anemia. And the most important thing, the option number D, inferior segment of the lower lobe is involved. This is not correct. Lower lobe, the upper part is involved, the upper segment is involved. So this is not correct. It is not inferior segment, it is the upper segment. And for upper lobe, posterior segment is involved, which is absolutely correct. Yes, this is a correct option. So the wrong options are B and D. Now, having completed all of this, let's move on to the next question. Choose the false statement regarding lung abscesses. Option A, CT scan gives a better anatomical delineation. Option B, empiric treatment should be avoided in lung abscess. Option C, bronchoscopy guided drainage can be used for drainage. And option D, none of the above. We have to choose the false statement. Okay, so let us understand. When a lung abscess is suspected, usually chest x-ray can be done, and this chest x-ray we can see a cavity or air fluid level, and we can also see associated pleural effusion. However, these findings are very difficult uh, for diagnosis because it is not very clear. Therefore, obviously, after this we follow it by CT scan, and if we do a CT scan, then we can easily delineate the anatomy clearly, and also differentiate between lung cavity and pleural effusion easily. So option A, CT scan gives a better anatomical delineation, is correct. So this is not our answer. The next question is that empiric treatment should be avoided in lung abscess. We must know that empiric treatment is preferred. Only thing, the antibiotic that we use, they should penetrate the lung parenchyma, and this antibiotic, for how long we should use, that is a controversial topic. uh, Guidelines vary. Therefore, the clear-cut line which is mentioned in Sabiston textbook of surgery is that there is no clear-cut uh, duration of the antibiotic treatment. Usually what happens is we use beta-lactam antibiotic plus a beta-lactamase inhibitor or carbapenems. Carbapenems are used. Alright, and antibiotic treatments are preferred. Empiric antibiotic treatments are preferred. So this is a wrong statement because it says it should be avoided. It is not correct. Empiric treatment is preferred. Okay, it is preferred. Our next option is bronchoscopy guided drainage can be used for drainage, which is absolutely correct. uh, uh, Bronchoscopy guided drainage, bronchoscopy guided catheter insertion If this is the trachea and there is this bronchi and there is a lung abscess, a bronchoscope can be passed and a bronchoscopy guided catheter drainage can be achieved. So this is also the correct option. So obviously the false statement is B. Moving on to the next question. Yes. Coming to surgical intervention, when surgery should be done. Surgical therapy in lung abscess is indicated in which of the following cases? Option A, there is persistent cavity greater than equal to 2 cm and thick walled. Option B, persistent cavity greater than equal to 3 cm and thick walled. Option C, persistent cavity greater than equal to 4 cm and thick walled. And option D, persistent cavity greater than equal to 5 cm and thick walled. It is definitely a one liner. We should be aware of certain one liner aspects. So the answer is, it is persistent cavity greater than equal to 2 cm and thick walled. There's one important aspect that I want to talk about. That is, it clearly mentions in Sabiston textbook of surgery, if antibiotic is given to the patient and the lung abscess size is more than 4 to 6 centimeter, or if abscess doesn't resolve with 3 months of antibiotic treatment, then mostly it is not going to resolve. It is not going to be resolved with conservative measures. Therefore, in those cases, maybe surgery is important. However, in the next paragraph of the textbook, it clearly says that there are certain definite indications for surgical drainage, and in that they have mentioned there is a persistent cavity more than equal to 2 centimeter and thick walled, then it is a definite indication for surgical intervention. Okay, so let us remember this. It is persistent cavity greater than equal to 2 centimeter and thick walled. Our next MCQ. Surgical therapy in lung abscess is indicated in which of the following? Okay, it is indicated in which of the following? Option A, failure to clear sepsis after 8 weeks of medical therapy. Option B, hemoptysis. Option C, exclusion of cancer. And option D, failure to clear sepsis after 6 weeks of medical therapy. So they have tried to confuse between 8 weeks and 6 weeks of medical therapy. So to answer this question, we should have read that part of the textbook, and it clearly mentions that there are certain specific indications for for surgical drainage, and they are: number 1, that there is failure to clear sepsis after 8 weeks of medical treatment. So it is clear that it is 8 weeks, not 6 weeks. And option 2, hemoptysis. Obviously, if hemoptysis is present, then we need to go for surgical intervention. And number 3, exclusion of cancer. This is also an important indications for surgical therapy. And to this, remember, we have to add one more point, that is, the lung abscess is greater than equal to 2 centimeter and thick walled. So with this information in mind, we can easily solve this question. They're asking in which of the following it is indicated, surgical intervention is indicated. Option A, failure to clear sepsis after 8 weeks of medical therapy is absolutely correct. B, hemoptysis is correct. C, exclusion of cancer, it is correct. But D, this is not correct. Okay, this is not 6 weeks, it has to be 8 weeks. 8 weeks is the correct answer. So with that, we complete an overview of the chapter, the segment lung abscess, with the help of certain MCQs. And I really hope that you enjoyed the session. And